Good afternoon, New Mexico. It's Governor Michelle Lujan Grisham. I want to thank everyone for joining us for our weekly COVID update. I want to start with highlighting these masks. We're all wearing matching masks up here. That's because they are produced and provided by iCount New Mexico. You should expect to see our census workers wearing these when they're out and about. And we want to highlight and promote. We've got very little time left to make a difference in responding to our census questions and making sure that that data is rolling up to the federal government. So we've got someone here who's leading that effort, the Director of State Personnel, Pam Coleman, and you will hear from her shortly. And I want to thank iCount New Mexico for providing these masks to all the folks who are working on census efforts and for making them available to us today. All right, I'm going to take it off so I can, I hope, be heard more clearly. Let's go to the first slide, which is our daily case update. We've got 177 new cases today. As we talked with Dr. Grace about modeling, that's all good news. But we want to keep lowering those cases, and we want to keep improving how we're managing in a COVID world. Note that that takes us to 22,987 total COVID infections in the state from beginning till to date. We have 128 people currently in the hospital. That's down. 30 people on ventilators. Unfortunately, we have not had a day where we're not announcing that we've lost New Mexicans. Today, again, unfortunately, is no different. We have 2 new deaths. That brings us to 697 total. And, you know, I get asked frequently about what is the most difficult thing about COVID, and it's talking to families who reach out to us, because remember, I don't know who anyone is and shouldn't, about loved ones who are in critical care or on ventilators in hospitals, and then what happens if we're lucky enough and fortunate enough that they make it and are in long-term rehab care, and talking to family members who had to say goodbye to their loved ones or didn't get to say goodbye, and how difficult it is in a COVID world to lose your loved ones and family members and neighbors and friends. And so for me, this is always particularly hard and painful. All right, we've done 650,491 total tests. We continue to have 50-plus sites open. We continue to work very productively with our private sector testing partners. A reminder to New Mexicans, we're working hard to get folks with symptoms. That's our first priority always, because we want you to get information about your medical care. We want to make sure that we are focused on giving you information that makes you safe, that gets you to isolate productively, that your family is safe. That takes more time in gathering, right, taking the COVID sample from you. Everyone else goes to public health sites. However, no wrong door. We don't want to discourage New Mexicans from getting tested. Part of our success in managing COVID and dealing with outbreaks has absolutely been our aggressive testing program. And in case it doesn't come up, I'm just going to take an opportunity before we go to modeling. Testing supplies are getting more and more challenging to come by. We're working very diligently to do that. So if you see that we've got fewer tests that are taken in a day or less of our surveillance work, we can only run the tests each day that we've got enzymes and related equipment for each day. And with no testing strategy at the national level, this means that we're competing with other states who have also had to increase and advance their testing and pooling. We're ready to do that, but for needing federal approvals still. So none of that is quite where it ought to be. My confidence level remains high. Instead of very high, that we get it all in when we need it, it's reduced to about high. But I do want New Mexicans to know that that's getting increasingly more challenging. It's an area that we all focus on, and I just wanted you to get a kind of heads up about where we are. And in fact, I've got a call if someone's going to ask me with members in the White House Task Force team on testing tomorrow to make sure that we're doing everything we can to be in the clear, to run as many tests as we can each possible day. All right, let's go to Dr. Scrace and get an update on modeling, and then back to me for an update with the Director of Personnel on Census.
Thank you very much, Governor. Good afternoon, people of New Mexico. Thanks for all your cooperation, collaboration in the public health orders, wearing masks, staying at home. We're seeing results from that we all should be very proud of. And I'm just going to go right to the slides. This slide I didn't have in last week. It's my favorite slide, though, and what we see is that we're now coming down quite rapidly off of our highest peak we've had in the coronavirus pandemic. And we're really dropping. There's a little divot there from a couple days where we did a few less specimen collections, but you can see that trend is coming down throughout the state. There's a lag on this, so we had a case count today that will help bring this number even lower, and so we're hoping to continue to see that trend. The good news is not only is everything coming down, and it's coming down exponentially, but we're also seeing that it's coming down in all the regions of the state, which are the different colored lines on the bottom part of this graph. So we're doing well, great progress. I'm going to talk about this number 189 a little bit more toward the end of the presentation, but just so I'll draw your attention to it. Remember that what brings cases down, well, let me start with what brings cases up. What brings cases up primarily is people having interactions with other people. That's how we get COVID. We share that same air with someone else, and there are droplets in that air that we breathe in, and that is in the vast majority, probably over 99% of infections occur that way. And so when we all come together and follow the public health orders or mask, and I'm going to show you some really great, interesting data today about how well masks work. That's what's helping bring this down, plus all the great work that our contact tracing team is doing to make sure people know when they need to isolate or be quarantined, et cetera. The next slide is just our usual heat maps. Maybe it's not the next slide. Could you go one more just to see what we've got? Yeah, there we go. Thank you very much. So on the left, a map of New Mexico with darker colors being more cases since the very beginning of the pandemic, and now DeBaca County, the only county that survived without having a COVID case. On the right, you can see how things looked over just the past week, 7 days of data that we have so far with cases. And you can see that things have flipped, that the Northwest is coming down, those colors are getting lighter. The Southeast is where our problems are, where we're seeing an uptick in cases. And you're going to see a darker colored southeastern New Mexico in a number of slides today, and that's where we're really focusing attention around testing and other interventions to try to see if we can control the pandemic better in that part of the state. Now, if you could move on to the bar graph, please. And these are the daily confirmed cases. I show this pretty much every week. A couple things I'd like to highlight on the left graph is, number one, that 15.7% now of folks under 20 have been infected, of our cases, that 15.7% of our cases are in people under 20, which is higher than the rest of the country, but we're sort of drifting down in the rankings on that, which I think is a good thing. But the thing to really point out is the undisputed leader in terms of the percent of cases this week are the folks 20 to 29. And so 20% of, basically 10% of the population represented positive cases this week. And on the right, you can see the death rates, again, by age. We're still doing well in the fact that we've had no deaths in people under 20 in New Mexico, but that's not true for every state now, and we are seeing both people under 20 and even people under 10 who are passing from COVID infections. So it's a serious infection, it's a serious virus, We continue to watch closely. Next slide, I'm going to do a little bit of medical updates for you today as well. Getting lots of emails from people who are saying, you know, don't minimize how long it's taking me or people I know or everyone to get better from COVID. You know, I think the word on the street is, you know, as long as you don't expire from the virus, it's kind of like a bad cold and you'll be fine. But now, as we've had more time to study the effects of the virus on people, and we've talked about a lot of those effects before, but we're seeing, you know, the virus seems to attach to and affect and inflame blood vessels, and you don't have to have a degree in anatomy to know that blood vessels go to every part of our body. And so the brain, the lungs, the heart, and the blood vessels themselves can show effects of infections after the infection. We talked, I think, last week or the week before about 70% of people having something that we can see on an MRI scan in their heart, and the literature keeps coming through. So people developing high blood pressure after a COVID infection or a heart rhythm problem, or just shortness of breath or brain fog. But lots of people, and I just wanted to, this is a recognition of those of you New Mexicans who are out there who've emailed me or haven't, who are struggling to recover. You know, we're with you on this, and it isn't just a cold, and we really want to acknowledge that what you're going through is real and it's hard, and please encourage your friends and others to wear those masks and stay out of harm's way until you're really feeling well. Thank you. This is my favorite slide this week, and the mask slide should be next. Too much information on here, but just a lot of it's pictures. So some folks at Duke got together, built their own little laser machine to count droplets when people were talking. And they tried 14 different masks, and they tried without any mask at all. So if you look on the graph on the lower right, you'll see control experiment, no mask, and it's relative droplet count. So 100% of the droplets when you're talking go out of your mouth. That's what that means. And if you look at the top, the N95 masks that ICU physicians wear or that people doing nasal swabs wear to get specimens, you can see that they let no droplets through at all with the mask. But there's some other really cool stuff on this slide I want to highlight. Second is that the surgical mask or procedure masks that actually are sometimes available commercially as well. I had a box of them in my garage from woodworking that I've done in the past. Those are good. In this experiment, were as good as regular masks. And then a 3-layer cotton with a polypropylene layer and another cotton layer, only 5% of the particles got out. And you can look through these, but immediately what jumps out is any kind of multi-layer mask is almost always better than a single-layer mask, which we've known for a long time. Two more things. Number one, if you're wearing a bandana and you're speaking, you're filtering out less than half of those potentially COVID-containing water droplets from your mouth. So bandanas, in my book, are now out. We don't have a public health order on that, but I know for myself, I'm avoiding people that I see on the street wearing bandanas because I know they're not very well protected. And a really strange finding is folks wearing the fleece gaiter type, sort of neck gaiter. It's wraps all the way around and you pull it over. That actually transmits more water droplets. Well, how is that possible? Turns out that the nature of those fabrics shred some of the water droplets and actually broadcast more. So if you're in the bottom layer or the bottom part of this chart, particularly not wearing a mask at all, but some of these less performing masks, think about this, look this up. This will be available online, and when it is, you can click on the title of this slide and you can read the article for yourself. Really well done. It's like a PhD level science experiment that really answers some practical questions that have been coming up for months and months and months, and now we know. Immunizations, a couple things I want to say. I want to reinforce that kids need their back-to-school immunizations. Even if you're planning on having your child stay at home and do distance learning, they still need those immunizations, and it helps us as a population because the last thing we want during a COVID pandemic is an outbreak of measles or mumps or some other childhood illness spreading through our population. Flu shots are now available in a couple pharmacies around the state, but everywhere in September. I don't know if you remember, but we usually tell people, late October, early November, best time to get a flu shot. But we're asking people to get those early this year, like we did when H1N1 came around and the vaccine came around in 2009. So get those vaccines. It will help keep influenza down so we don't confuse it with COVID. People don't get sicker from a combination infection. And very, very active planning going on in DOH about for the COVID-19 vaccine and building up that infrastructure to make sure that gets delivered. On the right is an infographic, and I just want to say a couple things about it. One thing is that this is United States companies that are developing vaccines here, and you can see that there's a 6-step process where they work in the lab. Phase 1 is maybe testing it on animals. Phase 2, small number of humans. Phase 3, thousands of human beings. Phase 4 would be the next step is emergency authorization, when the FDA would say this is safe for human beings. And lastly, the final approval. And there's a big announcement, I think it was yesterday or the day before, that a highly placed Russian official's daughter had received the Russian vaccine. I just want to make it clear that that Russian vaccine is in phase 2. So it hasn't even been tested on thousands of people yet. And so there was some sort of Russia declaring victory that they had won the vaccine race, which is, to me, kind of like being in a 26-mile marathon and raising your hands in victory when you get to the 10K mark. There's still a long way to go. And in our country, we value safety, and we value the science behind that safety. And so lots of irons in the fire, human trials and thousands of people underway for 3 vaccines. We expect to have options available. We also know that different vaccines may work better for different kinds of people. More on that in the future when we have more information. But we want to get in the United States to the EUA, emergency use authorization phase, before widespread distribution, and final approval will probably be very close to that as well. So I just wanted you to know, if you were thinking, why do other countries have a vaccine and the United States doesn't? And the answer is because other countries don't have their vaccine really ready for widespread human use. Now let's move to the map of the United States. I'm getting to the point now where I'm starting to whine about the fact that New Mexico is still red on this map, and I am. But there's really good news here, and it's the How We Reopen Safely website if you want to go and look. We're great on every single thing except for what they call the new cases per million per day, which is sort of our case count. And if you also remember, if you've viewed in the past, we've been working on coming up with the best possible target for that case count. So I'm going to talk about that a little bit more right now. We were just looking at spread rate, but what we're learning across the whole country is if you open schools with a low spread rate and a high case count, you're going to have a lot more trouble. They also found that in Europe. If you reopen certain public activities or businesses with a low spread rate but a high case count, that's a lot more trouble than with a low case count. And so we may talk later about states with schools that have reopened, but they actually have a case counts per population, per unit of population, that are 3 to 4 times higher than where New Mexico is at today. On the next slide, our old goalpost slide, last time you'll ever see the goalpost, at least in this context. We have assigned a target to that measure, and we're looking to get to 168 cases or less per day. We've looked at a lot of different methodologies, lots of scientific discussion, lots of public policy discussion. The governor made the final decision on the number 168. It turns out it's 80 cases per 100,000. For those of you who are interested, no, 80 cases per million, sorry. 8 cases per 100,000. But we're just going to talk about the number of cases, and that saves you having to multiply everything by 21, which we're counting on you being happy with. The gating criteria as a whole, all green, except what we're now realizing is the most important measure, and if I could please have the next slide, it's the blue and purple one, so let's go one more. There. You can see that we've got our spread rate's great, it's low. Testing capacity still hitting on all cylinders, and the number the governor gave you for the total number of tests actually gets us to over 30% of our population, or at least the number of tests divided by the population is over 30%. I want to highlight that this journey about getting supplies for our testing has been a long one, and it changes. You may remember that first it was not having enough PPE for healthcare workers, and then it was nasal swabs, and then it was reagents, and then it was nasal swabs, and now we're down to struggling to get simple things that the lab uses and throws away, like pipette tips or wells to put the specimen in. And so, I'm proud to say that our governor is fighting very hard for us, and does call these manufacturers to get supplies when we need them, so we can keep testing, so we can stay on top of this pandemic. Contact tracing, now I'll show you the graphs, doing great, and delivery system in a good place. I've said this before, but this big peak in cases we had, our biggest peak was not accompanied by a lot of hospitalizations, or by as many as would have been proportional to last time. So maybe stay on this graph. This is the daily case graph that I showed you at the beginning without all the regions. And the green line is our target, which is 168 cases per day, and you see we're really almost there. And I believe that in the next week or so, we'll get there. We'll see. Please keep wearing your mask, because if people think this is the finish line, it is not the finish line. It's where we need to be to start thinking about how we can add some other things back into normal life, like a small dose of in-person school. And those are the discussions that we'll be having soon. The next slide, just to mention, New Mexico was featured on CNN. This test positivity rate is the new hot COVID metric around the country, and you can see that New Mexico is just doing amazingly well, where low numbers are better. We have states with, Texas, for example, with a test positivity rate that's 8 times ours. So we're really doing amazingly well, and that's all due to the central focus of our testing strategy. And at the end of this very short feature on New Mexico, the announcer said, really credited the governor for her focus on science, her use of common sense, and the leadership that she's exhibited. And it's really great for all of us to partner with all of you in New Mexico to be part of a team that's achieving these kinds of great results. This is a new map that you haven't seen before, and it looks like some of the other maps, and this is a map that our testing team uses to say where should we focus our testing. It combines how we're doing on that test positivity rate and how we're doing on proportional case counts for each county. And if you're a red county on this map, that means that you're over what we're trying to, your cases are too high and your test positivity is too high. And so our teams are trying to focus more effort in those areas to get in there and test and identify more cases so that we can contact those people and isolate them and find out who their contacts are and contact those contacts, that sounds redundant, and get them quarantined. I mentioned this last week, but we're starting to have issues being raised here in New Mexico. The Department of Health will never ask you for a Social Security number, credit card number, anything like that. And so if you get a call like that and you're asked for that kind of information, it's fraudulent. Please try to take down as much information as you can and notify our Attorney General's office. So this is a way that we can focus our testing. We're also using this construct to be more cautious about reopening nursing home visits, which are, as you know, going to start happening very, very soon. But it's a way of keeping our pulse on a weekly basis of where we have too many cases, where we have too high of a positivity rate, so we can intervene and keep this down, keep this pandemic under control. You can see this giant mesa of contact tracing where on the left, this is the time it took us, on the next slide, sorry, if I could have that one, please. There we are. This is the number of hours to reach a positive case from the time we get the result. And you can see we're back now under the target. And on the right, we have the number of hours it takes us to reach that case's contacts and get them quarantined for 14 days, and we're back under the target there. So all in all, things look really good. It's a credit to the behavior of New Mexicans and your diligence in wearing masks and obeying public health orders. But we can't really move forward, and if I can go to the next slide with the two light switches on it, we can't really move forward unless we all stick with this. This is not a finish line. We're not flipping a switch on once we meet the gating criteria. It means that we can start thinking about and planning for possibilities to reopen. I think when we did the very teeny reopening back in June, I think here in state government, we thought it was like the dimmer switch there on the left, that we were just going to turn it up a little bit and, watch really carefully. And I think what happened is that folks interpreted that meeting our gating criteria as flipping that switch on the right, turning the lights on bright. And so, and as you know, from the curves I just showed you, that we had a huge surge in cases after that. So we need everybody to get, to buy into and support us in this dimmer switch program. So the lights won't be all the way on, really, and to continue the metaphor, until we have a vaccine and most people have gotten it. But we can do a little bit more if everybody continues to do what they're doing now. So stay at home unless you absolutely have to go out. Wash your hands, keep things clean, don't cough into your hands. Everybody really needs to wear a face covering in public, and now you know what the best kind of face coverings are. I know there are a lot of people out there that just love those bandanas, but you're actually putting other people at risk when you wear them. And we'll probably get more information on the whole fleece mask that wraps around, but I would encourage people not to use those as well. Just our mental health line, we have an app for that, and also a support line number. We'll leave it up for a second. But all in all, we're doing well. We're making progress, but we have to keep doing what we're doing if we don't want to see that curve go up. And if we want to be able to do more and get kids back into school, we have to do even more than what we're doing, which in most cases means that instead of 65 or 70% of people wearing a mask every day, that we get up to 90% plus. And with that, I'm going to turn it back to you, Governor. Thank you.
All right. Thank you very much, Dr. Scrace. Next, I introduced her earlier, and I hope I didn't have to introduce our incredible Director of State Personnel, who's leading our efforts to make sure that we get as many folks to complete their census. And the Director and I'm going to start it by reminding folks that if we don't do this and we don't improve our responses, it means incredible, sizable losses of federal funds that mean everything from housing, roads, health care. We must have access to those funds. They're based on your population. Your population in this context gets based on the number of people who fill out their census data, so we know who's in a household. It isn't used for any other negative or nefarious purposes, completely illegal. You're absolutely protected, but it gives New Mexico an accurate depiction of our population, which means then we're in a position to acquire and have access to funds that, frankly, are allocated for us, for our population. So if we don't do it, we really lose out, and I want the Director to tell you more about that and where we are and what to expect. Director Coleman.
Thank you very much, Governor, and thank you, Dr. Scrace. The numbers all tell a story, so every week when the Governor and Dr. Scrace describe where we are with respect to the gating criteria, with respect to where we are with our numbers, it's all about for folks to take action. And that's the same that I'll talk about today with the census, because the numbers are also telling a story. As the Governor referred to, New Mexico receives about $7.8 billion a year, and that's with a B, billion dollars a year, based on the last census, which was in 2000. We want to make sure that we are encouraging all New Mexicans to take the very simple and easy steps of completing their census in order to become counted in the 2020 census, which will then have dramatic effects for the next 10 years. So just like wearing a mask, just like staying home if you don't have to, just like socially distancing if you have to go out, it's the same thing with the census. Action matters, and very simple action matters. Simple action makes such a big difference. The census is only 10 questions. You can do it online at 2020census.gov. You can make a phone call, which will put that number on the screen. You can, there's for folks who are hearing impaired, that's in Spanish. There are so many easy ways to return the census, respond to the census, including folks in New Mexico who would have received an envelope or a packet from the U.S. Census at your door. So when we talk about the risk of not being counted, we're talking about big dollars. We're talking about dollars that go into every bit of the health care that the governor and Dr. Scrace have described and continue to describe. It goes into education. Health care means $5 billion a year to New Mexico. Education, federal dollars account for $770 million. Roads, infrastructure, over $400 million. For housing, $115 million easy. And all of these amounts are per year. So the stakes couldn't be higher. And to the extent that we do not count, self-count, count as a New Mexican, we stand to leave money on the table. And that's something that no one can afford in any year, especially during these very critical times with a public health emergency, with a pandemic. It is incumbent upon all New Mexicans to take their responsibility seriously and do something that's so simple, which is a 10-question questionnaire. So the census happens every 10 years. It's provided for in the Constitution. The Constitution says that we will count every single person who lives in the country, everybody, regardless of how old you are, regardless of your immigration status, regardless of your race, your income, where you live, what part of the state, what party you, it doesn't matter. Every single New Mexican, every single person in the country will get counted. It is guaranteed by the Constitution. But you have to do your part first and complete the census in order to guarantee that you will, that your number will go in with all the folks in your family, in your community, in your county, in this great state of New Mexico, in order for us to be able to go back to the federal government and have them allocate appropriate money to us. So if we can put it even in more simple terms as to what that money means, for everybody who doesn't get appropriately counted, it could mean one less hospital bed. It could mean one less vaccine when we finally have a tried and true and tested vaccine. It could mean one less rural fire truck in someone's county. It has that kind of significance if we do not appropriately get counted. There's some myths about the census that I'm very happy to go through, and there's a slide for that. So these are census myths that we hear pretty frequently. One is to say, well, I have to wait for one of those census workers to come to my house and ask me questions. And that's a myth because you can complete your census online. You can complete it by phone, and you can complete it by completing it in the envelope that you would have received in the mail and return it. It's as simple as answering 10 questions. If it takes you more than 10 minutes, I would be surprised. Everybody reports back in when any sort of like, oh, I thought it was going to be a little bit more complicated. I thought I would have to answer questions that I didn't know the answer to. No, you know all the answers because they're all about you and the folks who live in your household. The second myth is that your census data will not be secure, and the governor referred to this. The truth is that federal law prohibits the release of your information, and in fact, every U.S. Census worker takes a sworn oath to protect your information for the rest of their life. So not only when they're working for the census, but they are prohibited from sharing your information for the rest of their lives. The next myth is that I only need to count the adults in my household because, you know, little kids, why do they count? Even babies, why should I count a baby? Everybody needs to count. So if you think about someone who was born in your household, you know, the last several months, that little person will be in the 5th grade in 10 years. And when it's in preschool, when it's early childhood, when they're in kindergarten, when they're in elementary school, every single dollar that we can attribute to that little person today will stay with them for the next 10 years. And for math purposes, every single person I know that Dr. Scrace likes the math problems. I'll give you a super easy one. Every single New Mexican who is counted is the equivalent of about $3,700 a year. Times 10 means $37,000 per New Mexican. If only one person in New Mexico per county is not counted, New Mexico loses $1 million. If one little baby in every county doesn't get counted for this census, that's $1 million that little kids do not get when they're by the time when they're in the 5th grade. The next myth is that, well, I thought that deadline had passed. You know, I've heard a lot of crazy things about when, was it in April, was it in October, and so your time is not passed. The federal government did accelerate the timeline, so the deadline is September 30th. That's 48 days from now. But the census is so simple that you can complete it today. And it is online, 2020census.gov, or by phone in English and Spanish, or if you're hearing impaired, there's a TDD number, or if it's still on your kitchen table because it's an envelope and you haven't gotten around to it, you can complete it and put it back in the mail. It's that simple. So again, you do not need to wait for anybody to come to your door, and in fact, most people would prefer not to have someone knock on their door right now, even though the census has had trainings, and I would like to make sure that we talk about the trainings that the census has had, and that they have made smaller trainings in New Mexico as a result of our good practices, of the governor's good practices, of Dr. Scrace, and all of the good folks in New Mexico who are taking care of us from a health perspective, that the census workers will come to your house if they need to, with a mask, with hand sanitizer. They'll knock on the door, they'll step back 6 feet, and they'll ask the questions. But if you complete your census by phone, by online, or by returning in the mail, then a census worker will not come to your house. They will not knock on your door because they have sophisticated data, and they say, oh, okay, I'm going to go this house. They completed it. I won't knock you. The next house, I don't show you completed it, so I'll have to knock your door. So again, completing the census, 10 questions, super simple. They will not ask your social security number. Nobody asks your citizenship. All they want to know is who's in the household. Does somebody live with you? Do you have roommates? Count them. Are you grandma and grandpa and your whole family has moved? Count them. Do you have folks who are living in your house, and count them? You want to count everybody who's under your roof. You want to count them. They deserve to be counted. You deserve to have them counted. New Mexico deserves to be counted. The last thing we'll talk about today is that when we think about why we participate, and we think about who can participate, and we think about where New Mexico is right now, we are not where we want to be. So we're at 53.7% of New Mexicans have self-responded. That means they have gone online, they've returned it by mail, or they've made a phone call. 53.7%. So what our goal was when we started this the census before COVID came down was 60%. So we're making steady progress, but we need to make better progress, because it's not about winning a number, it's about every single number means that a single precious New Mexican was counted that will roll up into our entire state count, which will allow us to receive our fair share of federal dollars. It's only our fair share. That's it. But $7.8 billion is enough for all of us to think about who's in my family, who are my neighbors, who's living in my house, who can I encourage to complete the census, how can I be the best census ambassador possible, how can I learn a little bit more about what these dollars do for my community. Think this, it does everything. It does healthcare, it does roads, it does education. These very important components of what happens in our daily lives is controlled by the census. So, my parting words are, the census is really important. The census is about you, it's about us, it's about all of us together. When we talk about our COVID best practices and how we are taking care of each other, that wearing a mask is not really protecting me as much as it's protecting you, that's what the census is about. Complete your census. Do it for yourself, do it for your family, do it for your community, do it for New Mexico. And I really appreciate the opportunity, Governor, to talk about the census today, and I will turn it back to you. Thank you, Governor.
All right. All right, thank you very much, Director Coleman. All right, so I'm all about beating every other state because it does. It brings more revenue in, making sure that we do the very best we can, saves lives with COVID, and allows us to get to economic recovery. And I'd love to even see, right, a resurgence of economic activity in the state. And that happens, it's all based on largely our own behaviors. So there's no reason not to get to 60. And New Mexico, with 48 days left, let's get to 80% or higher return rates. It really is that simple. I got mine several months ago in the mail and returned it immediately, as did my fiance. So let's get that done. 2, I predicted that if New Mexicans would help us buckle down, beat back the virus, that we could do that quickly. We did. I think it really demonstrates that if we limit our activities, we limit the contact that we have with individuals, and that we wear masks and do good hand washing, that those activities absolutely make a difference. I can remember, I can't remember, let me do it another way. I can't remember a day since being governor where one of the measurements that people want me to look at is why aren't we doing as well as our surrounding states in any number of areas? If that's recruiting nurses, or if that's educational outcomes, or that's economic activity. We are beating all of our neighbors. Most of the states and the White House Task Force are looking to New Mexico's leadership on the public health data and the science. And we're clear, we can all do more, we keep doing more, we keep digging deeper, but we are really doing a good job. We have to do a better job, and we have to be able to show that we can sustain it. We're in this, it's a marathon. And I don't want folks to feel like because we're doing as well as we are that we can give it up, that we can slow up. We have to keep going. We have to keep running no matter how exhausted, and we're all COVID tired. It is a real thing. The entire globe is COVID fatigued, because it takes a huge amount of self-discipline and, quite frankly, self-sacrifice. And every time, right, we lose someone, we mourn that as a country. We lose somebody in the United States every 80 seconds. And we lose businesses that have been in families for generations. We mourn every single loss in the way that we should. But we can prevent more of it. I think this country should think about trying to prevent all of it. New Mexico can lead the way. I'm very concerned, as you saw from the heat map, southeastern New Mexico, we continue to see cases rise. We've got to do better in southeastern New Mexico. And we can see from the data points that we use that mask wearing and traveling we're not doing more in mask wearing in those counties, and we're not doing less travel in those counties. Both have to occur, more masks, less travel. And we're really focused on that. We saw another increase in rapid responses. So we're seeing cases being transmitted into businesses that require rapid response. Where are we seeing a high level of activity? 30% of all of our rapid responses, so irrespective of the population, one would argue that in Albuquerque, and as large, right, as Albuquerque is, that if you're traveling from the northeast heights to the west side, that you can impact any number of businesses. Well, note, in a smaller county, the southeastern counties, Eddy and Lee, we're seeing 30% of our rapid responses are in businesses and organizations that represent southeastern or southern counties. That's an issue. We can see how the virus is being transmitted and moved. We can do something about that. It's not fair to those businesses. Remember, they have to close down for a rapid response. All right? We have to test everyone. We have to sanitize the business. It's imperative that we just do better. But I also want New Mexicans to feel good about the fact that when you do your part, and you are, we see immediate returns, and we keep saving lives, and we're protecting our healthcare workers, and we're allowing us to get to a new normal. I want to congratulate ourselves on lowering that positivity rate and seeing the cases decline. That is a big deal. What I don't want is for what Dr. Scrace alluded to. We don't want New Mexicans to say, we did it. The race, I finished it, I'm done. You can't. We're still in it. It is a marathon until there's a vaccine. And frankly, you're going to hear us talk about that New Mexico, if we're going to really do effective public health preparedness, and we're going to be better at and a better partner for the nation in terms of public health protections, and we're going to have to think about mask wearing aspects and much more distancing and much more hand washing. Just that'll help us with flu. And really keep thinking about it. We lose someone to COVID in the United States every 80 seconds. We don't talk enough about, although we started today, that while people absolutely are recovering from this vicious virus, we are yet as a nation to have adequate evidence and science behind exactly what are the long-term chronic issues and permanent health issues and damages resulting from contracting the virus. Last thing, I want folks to know that our 10 to 19 and 20 to 29 age groups continue to be a significant group for infections related to COVID. So this is a huge problem because these are populations, high school, college, right, and moving. And here's what our contact tracing, now that you're seeing that we're meeting those deadlines, here's what we know. Vast majority of the individuals infected from family gatherings. We need folks to stop having these large family gatherings. And I realize I'm asking a lot. We have COVID fatigue. We know that general well-being is all about being with our families and our loved ones. That every other, right, social and health determinant aspect, you can look at the connections between good family relationships, positive family relationships, say a whole lot about everything else we care about, including good emotional health. Except in a COVID world. In a COVID world, it's the worst possible situation. I need everyone to really buckle down and work hard to meet that 5-person limit and to really stay in your own family pod, which means you don't extend it to grandma and grandpa, your aunts and uncles, or your really close neighbors that you might think of as family. No backyard gatherings. Really work hard and particularly with Labor Day coming, you've got to resist, right, the temptation to doing that. Because if you don't, we will see, right, up to 5 weeks later, increases in cases. And what will that do? That will create more risk to schools and will also bring in risk that we can't tolerate in places like nursing homes and for other areas where we know that rapid spread occurs. We lose lives, and our ability to contain it once it gets in is highly minimized. So, good news, good news, good news. I need you to stay the course. Congratulations, New Mexico. I'm grateful to you and your leadership. Let's keep showing the country how it's done. Let's beat back COVID. We're all together in this, New Mexico, and thank you. Let's do questions.
Thank you, Governor. First, I'm going to go to Susan Montoya with the AP. Susan, you are unmuted. Go right ahead and ask your question.
Yes, Governor, you had just mentioned the Labor Day weekend coming up, and we also have the timeline that has been set for schools now about reassessing whether to go back after Labor Day. So what could you possibly tell New Mexicans so that we be sure we don't have another surge like we did over some of the summer holidays?
Well, Susan, I really appreciate a second opportunity. I mean, you did it for me, and I really appreciate that. Look, these long holiday weekends are really ripe for us to think, you know, I feel safe, my family, we're going to wear masks, it's going to be fine. It's not fine. You just create risk. And, you know, it's really painful when we read about in a news story here and across the country where someone thought it was safe, they were celebrating a holiday. Labor Day is a worthy thing for all of our working families to celebrate all of our hard work. Everybody wants a backyard barbecue and what we perceive as a day off. And if any state and all the state workers and all the private sector workers deserve a day off, it's in COVID, where we all are working extraordinarily hard. But it is not worth the risk. And when you look at some of the stories out of Texas just recently where people thought it was safe and you have a family gathering of 30 to 50 and 14 members of a family are infected and there are several deaths and several hospitalizations as a result, it's not worth the risk. The second thing you asked me is if we do that, we won't know the next day about the risk to kids. That's true. But we know risk is coming, and so if we care about protecting kids, and we do, then we really have to keep this up. Frankly, I would argue we have to even be better. Let me give New Mexicans some examples. All right, just meeting the gating criteria, it's a moment in time. I don't know what it's going to look like tomorrow. We look at that exit strategy map. We're green, we're yellow, we're red, we're bruised red. It is a moment in time. It requires constant effort to beat back the virus. We've got 5 school districts that I want to just point to, who have all had, frankly, a very poor school reopening over the last couple of weeks, right, where we have hundreds of infections with kids and with the faculty and educators in schools, right? So let's point to Georgia, Mississippi, Alabama, Oklahoma, and India. I want to point out under the best circumstance, Germany, where we highlight really progressive, proactive activity by other countries where they really beat back the virus. And we talked about getting our infection rates below 1, that's how you look at economic recovery. They did all that, right? In Berlin, 8 school districts. I would argue that they have much more cohesive, right, attention towards mask wearing and other public health aspects. Why? Many of the European countries have a really robust investment in public health strategies, and this country hasn't paid for it, hasn't educated people about it, didn't do it. So we're different than our European neighbors. But Germany is a really good example where they did all those public health things arguably right. Berlin, 8 school districts, infections. So here's the message to parents. We are going to keep promoting what's safe. We're going to go really slow because I know, based on all of the data, that I can't guarantee that COVID doesn't get in. How does it get in? It moves with person-to-person contact. We're going to have contact. Unlike a lot of the school districts in the country, we have very firm COVID-safe practices. Shout out to our education partners who are adhering to those in large part, although New Mexico, we've got some superintendents and some school districts who are pushing back. And the problem with that is it creates a safety issue for your educators and your children. So we're moving in the right direction. Please don't interrupt that for Labor Day. And we're going to have to keep looking. And here's one last thing. The next 2 weeks gives us great opportunity to not only look at how we're doing, because we'll see the case rates every day, and we'll see the positivity rates, but it will also give us an opportunity to see how things are going in other school districts and to compare their COVID-safe practices with ours. Because if it looks like no school district, even in a hybrid setting, can adequately protect children and their educators, then we're going to have to put out different kinds of guidance. But today, based on the science, based on common sense, based on how we're doing, we're as confident as we can that we can mitigate it to the highest degree, which means that we can embrace the emotional well-being of children, educators, give them a boost in their educational outcomes by going to our hybrid efforts the day after Labor Day with K through 5. But I really want folks to think about how hard we have to work to manage that. We cannot afford to expose one child. And for people in this state and around the country that don't think you lose children to COVID, certainly not in the high-risk groups like we see with older people or people with chronic care conditions, but it is untrue that this country hasn't lost children to COVID. And it is a risk I'm certainly not willing to take, and I can't imagine anybody else is too. So it's good news, and I can see the doctor wanting to raise his hand, and it's tough news. We're doing everything right. Stay the course. Great question. Push hard to make sure that we get the lowest case rates possible. We keep lowering the positivity rates. That means the prevalence of the virus is really mitigated. But let's do this cautiously and smartly and prudently, because that's the best way to protect our kiddos and our families and our education workers. Dr. Grace.
Yeah, thank you, Governor. I completely agree with everything you say, and I just want to take a moment to highlight all the work that the modeling team and Matt and the governor's staff and the governor have done to come up with great gating criteria. I mentioned earlier that what we've learned is that new cases per day is probably the most important of all our metrics. It's now in our gating criteria. But just to give you an idea that the 5 states the governor mentioned, if they had our gating criteria, they would have not reopened schools. Georgia, which is the place where we saw the media pictures of crowded hallways of kids, none of them wearing masks, they have corrected for population daily case count 4 times higher than New Mexico. Mississippi, Alabama, 3 times higher. Oklahoma, 2 times higher. Indiana's the only one that's even close, and that's more than half again as many as we do. And so we are, it's a learning process. We're always studying metrics and what's going on in the country, but we've set this up to be safe for our society when we get to the point where we have the room to do a little bit more than we're doing now. Thank you.
So good news so far for schools, but we're going to continue to proceed in the same productive, proactive, cautious way. Next question.
Thank you, Governor. Next, I will go to Patrick Hayes with KOB. Patrick, you are unmuted. Go right ahead.
All right. With less testing going on, can you elaborate on how we know that that 168 7-day average is going to be the magic number?
Well, because, yes. So, Patrick, it's not just that 168 is based on math. That is how many cases per 100,000. So even though, and you can look at your positivity rate. So yes, if we tested a bunch and we had a little more than that 168, it's also a 7-day average, right, to sort of account for testing shifts. It shouldn't really dramatically per 100,000 shift that. If we can't stay at 168, irrespective of how many people we test, if we're having too many cases, it means that there's too much of the virus being spread around. So we think that that is a very effective metrics, and frankly, we're not the only ones that think that. That's why it's part of that exit strategy on the Safe Exit Strategy national map. What's really important about testing is this. We want New Mexicans. I've really fought very hard for this, and my science team, you can actually, here's a place for you to disagree with me. I think creating testing confidence and surveillance. So if we tested all 2 million New Mexicans, if our positivity rates are low enough, you should end up with the same per 100,000 number of cases because people don't have COVID. Do we know that there are people with COVID that we don't get tested every day? Absolutely. For every case that you know about, there are several that you don't. That's why contact tracing is so important, because we do so much work, and our promotion, if you will, our discussions publicly about what you have to look out for. You limit your contacts with people, so we isolate the virus. That's the whole reason that we have to do all the other public health measures. So yes, we're incredibly confident. It's the supply chain that is going to keep shifting even though I've got high confidence that, we'll always meet our gating criteria in testing. And for someone who asked me a couple weeks ago, thank you, New Mexico has always had the ability, and it's the standard that I want. If you get tested, you should be able to get your results the next day. Has that been interrupted? It has. How does it get interrupted? Because we don't have enough enzyme or supplies to run all the samples we get all at once. And that makes me, frankly, very unhappy, because that's not a standard that this country should allow to occur. And so I start chasing more supplies. But the more states with outbreaks and the more testing that they're doing, because we don't have a national testing strategy, and that makes me feel bad. I shouldn't be competing for testing supplies with our neighbors. I want them to get COVID under control. We do better when the country does better. So it's a real issue, but that's the thing to really pay attention to. And I can see, Dr. Scrace, I've got great peripheral vision. I just want everyone to know I don't need to go to the optometrist, because I can see Dr. Scrace wanting to make sure we get the math right, which is why he's here, because I do listen and follow the science. Go ahead, Dr. Scrace.
Governor, your math was exactly right. One of the things that CNN highlighted that I wasn't even aware of is New Mexico is the #1 state in terms of low test positivity rate in the western United States. And so while our testing numbers have gone up and down a little bit, that infographic we showed you from CNN showed New Mexico sitting at around 2.4, 2.5%, and almost every surrounding state in double digits. So that's a very important and very valid question and of grave concern if you're living in Texas right now, given their test positivity rate over 20%. But we're the best in the West. That's what the statistics show. And so we have room, actually, with our testing strategy and we have much more accurate counts. With only 2.5% positive, 2.6% positive, that number of people who may be out there that we're not testing is about as low as it can get. Thank you.
I know that the folks who are in the queue to ask questions want me to go faster, but I think it just bears repeating. Would we have more positive cases if we tested all 2 million? Yes, because you've got more people who were tested, and you know that right now at our positivity rate at 2.4%, it should be 2.4% of that population. But here's what's really critical. If your testing is within the range, that's why we set a testing range, right? We want to meet that 5,000. Then you know that you can meet, right, the per 100,000, that 168 7-day average. That's what you're looking for. I don't want folks to get into this place because it's not scientifically or mathematically correct. So when the president in a COVID briefing says the only reason we have more cases is because we're testing more, that is one of those half-truths. You're seeing states that are having increased exponentially positivity rates and exponentially increased number of deaths, increased exponentially number of hospitals. You have a COVID spread problem in that situation. You're testing more because you have more people who are symptomatic and sick, who are asking you for help, and you're seeing it translate into all the negative metrics. So I don't want anyone in New Mexico to fall prey to that half-truth. Frankly, it's not a truth at all. I was trying too hard to give some of the White House task force's briefings some credit. And that's why your question, Patrick, was really effective, I think, so New Mexicans can really understand both sides of that issue, and it gave us a chance to talk about why we have a variety of things in our gating criteria, so we always know that we're doing what we should to protect New Mexicans, and we can tell you about how safe it is out there based on the work that we're all doing together. Next question.
Thank you, Governor. Next, I'll go to Dan Boyd with the Albuquerque Journal. Dan, you are unmuted. Go right ahead.
Yeah, good afternoon, Governor and Secretaries. Thanks, as always, for the opportunity. Governor, wanted to ask you, the U.S. Senate adjourned until September today without acting on a new COVID relief package. Wanted to get your thoughts on that. And as a related issue, I understand your administration has applied for the expanded unemployment benefits being offered under President Trump's order, but they may not be wanting to contribute kind of the state match portion. I mean, if you could address that issue.
Yes. So, Dan, I'm deeply disappointed in Congress and in the White House for failing to come up with a deal. Look, every governor right? So the position of the National Governors Association which is both parties, it's a non-political organization. We all work together to identify policies that would make the biggest difference for states. And a second stimulus dealing with flexibility, making sure that we extend unemployment at the $600 level, that we provide enough money to states so that we can continue to deal with the economic losses that are real. And we are all deeply disappointed. So one strategy would be to say, look, I'm going to wait and just see if we can get the $600 out of Congress when they return from going back to their districts. I can't do that. As I understand it, New Mexico was the first state to apply to FEMA for making sure that we could, in addition to our unemployment baseline, have the additional $300. That's actually going to be a nightmare for both recipients and for the Workforce Solutions Department to readjust. But I want every New Mexican to get as much as they are entitled to, because this is going to lead to another economic crisis related to not having enough income security for our families in the state. And I think the strategy that if people don't apply, that it'll force Congress. Look, I got to protect New Mexico families first. So we get out of the gate, and the match is consequential. So I'm working with the White House, asking to see if we can get either a waiver or exceptions to that, and really highlighting. And I highlighted for the White House yesterday that we expect not to have to meet the matching requirements for continuing the operations of the National Guard under Title 32. So they've got our written request, but I had a conversation with the Chief of Staff of the President yesterday and am asking for them to make sure that they include New Mexico in either the permissions to make sure that we can operate without those matches, or giving us opportunities for waivers. And we'll continue to do that. Dan, I don't know what the White House will determine, and I've got to be hopeful. I'm going to continue to weigh in with our delegation, and they're fighting hard. And I've been asked to reach out directly to leadership in both the House and the Senate to see if we can't help, to whatever degree we can, bring parties back together for negotiation. I hope that the White House and the Senate and Congress will come back to the table and look to determine what's palatable for both sides, that helps states continue to support their businesses and citizens during this crisis. So I have to be cautiously optimistic that they'll do something. But for New Mexicans watching, I also have to be a realist and a pragmatist. It doesn't look good, and I think that there is full-scale disappointment by every governor that we're not further along at benefits that will make a difference in our states. Next question.
Thank you, Governor. Next, I will go to Chris McKee with KRQE. Chris, you're unmuted. Go right ahead.
All right, thank you very much. I had a question first about concern that I know, Governor, you have addressed in the past, but we're hearing more about this as school is starting up. Parents in the East Mountains near Albuquerque, Belen, Los Lunas, Chama, Southeast New Mexico. We've heard from parents from all those areas sort of reach out to us complaining about problems with internet connectivity for distance learning. Is there anything the PED can do or is doing at this point to help maybe improve connections? Obviously, that's a big infrastructure question when you talk about internet. And one other question just related to the Rail Runner. Given that a lot of communities, municipalities across the state are running bus services now, do you anticipate Rail Runner service starting anytime or restarting anytime soon? As I understand, they're kind of waiting on word from the state before they can resume service. Can you sort of clarify what may be next for them? Thank you.
Sure, let's do the first one. This is really hard, and I don't want to minimize that. The state does not have adequate connectivity, broadband, pre-COVID. It's a significant infrastructure problem for education, healthcare, and the economy. I have to say that in the national debate, as we have an election, people might have heard coming in November, we're going to have debates by both presidential candidates who are going to talk about infrastructure and broadband, and we have to have it. New Mexico needs $2 billion, and make no mistake that after the election, as that becomes a new focus and priority for the White House, whoever wins, and for Congress, we're going to keep pushing to do that. But beyond that, these parents have real significant challenges and issues. And so, yes, we're developing Wi-Fi hotspots. We're trying to come into these communities. We're engaged with an idea that would bring Wi-Fi with sort of balloon access. And I got to be careful that we can't just employ any idea if it doesn't work, but we've got to do a better job. I want New Mexicans to be clear. I am concerned about those limitations. I am worried about what happens to families. We're going to do a much better job. We're delivering a bunch of notebooks, I think, to students on the Navajo Nation in the next week out of our All Together New Mexico fund. We had a Santa Fe donor that wanted to purchase all of those for a particular school district, so I'm thrilled with the generosity of New Mexicans, but a device isn't going to make any difference if we can't address the connectivity. I would ask those school districts and parents to keep working with PED. We do have federal funds that are supposed to connect up that last mile and to invest in a variety of strategies, including hotspots. So please reach out to us and let us know, and I'll get based on this question, Chris, I'll ask Secretary Stewart to really do more to encourage. We're asking for plans by every single school district. Note that we've already started our distance learning. So if schools are really struggling, and many of them will, because we don't have connectivity in this state. Rural states around the country are hit hardest in this issue to meet our educational both requirements and desires to meet the needs of students and families. Please reach out to us, reach out to your superintendent. They're supposed to ask us for what we call gear funding from the feds and our CARES Act relief money that goes directly to the Department of Education. And I know that folks are going to be frustrated with that answer. I'm frustrated. This is a state that should not still be struggling with broadband or connectivity or access for any household. And it's just a fact that we still are. So we're going to do everything we can, and I have no doubt it's not going to be enough. And we want to be as flexible and creative as people can help us. And so frankly, maybe this is a pitch to the private sector. If there's a private sector company out there in New Mexico who thinks that they can do more than we've got on our agenda, we want to partner with you. A call to action. We should be able to resolve this to a higher degree, and I am willing to do whatever it takes to do it. But today, I'm not confident that it will solve the problem for every single district and every single student. And I need to be truthful about that for the state.
Rail Runner.
Oh, Rail Runner. Rail Runner is in our list of things that we need to think about. Remember the dimmer switch. I don't want to go too fast, but it is an issue, particularly, you know, for commuters. The good news, maybe if it's good news, and we got to be careful about that, the vast majority of public workers, local government has also really asked folks to do work from home, so telecommuting, that I don't think we've had the same kind of issues where folks can't work, even though we do have connectivity issues by virtue of not having access to the Rail Runner, but we're seeing good success for public transportation in our cities and around the country. And it is on the agenda that the better we do, the more risk we can introduce. But no, I have not made a decision, and I don't think that will happen this week. Thank you very much for reminding me.
Thank you, Governor. Next, I will go to Jens Gould with the Santa Fe New Mexican. Jens, you're unmuted. Go right ahead.
Hi, Governor. Hi, Secretary. My question is, given that almost all of the gating criteria is being met, except for one, which Dr. Grace said might be met within the next week, in terms of the probability that schools will be able to go to a hybrid model after Labor Day, and that on September 1st, after the current health order expires, you'll be able to reopen some of the economy more, such as indoor dining. Can you assign a probability to how likely it is that that will happen? Could you say, you know, there's a 50% chance we'll do those things or more, just to give us a sense of when that reopening may happen and how likely it is? Thank you.
Jens, I'm going to do it a different way. There's 100% chance that I desire to do as much as we can to reopen the economy. And every time the gating criteria is met and we have good news, then I can guarantee you I'm feeling much better about our ability to introduce risk. It has to be really slow. It's got to be really smart, and I can't predict that for you. And maybe I can do this in a testing example that I promise won't be too long-winded. If I test today, if I took a COVID test today and I'm negative, and I go out tomorrow and Saturday to the grocery store and run some errands, that doesn't mean that I'm not going to be positive. Let's give it a little incubation period, 4 days after that. It's just for that moment in time. The gating criteria is useful, prudent, smart, and important, and it is our guide. But you have to sustain this, and the lesson everyone is learning around the globe is the length of time for which you sustain it says everything about the success rates of reopening and how much you can withstand introducing risk. And I want a message to New Mexicans who really desire to do indoor dining and to restaurants. Restaurants are an important part of our economic success in this state. And there isn't anyone in New Mexico, I don't think, who doesn't remember that I've promoted that in our outdoor economy and in tourism and hospitality, that being a food destination is a meaningful mark, right, for increasing tourism opportunities, which have immeasurable almost. I mean, it's huge impact on our local economies. And when I mean immeasurable, of course we measure what the economic activity looks like, but I can't tell you how many new businesses can sprout up when you have a really good tourist environment. Tourism is high risk. Indoor dining, high risk. Indoor activities without masks, high risk. Duration, mask wearing, close quarters, ventilation systems. That's not restaurants' fault. It's just a dynamic about how the virus spreads. So I don't know when that is, but I also want to say one more thing. We know that that the longer it takes us to have really productive long-term control over spread in the state of this virus, the harder it is to message to small businesses that we're going to make it together. And so we are motivated. I want the Mexicans to be motivated. You want your restaurant in your neighborhood to make it, and they need to do indoor dining, and we don't have summer forever, then we have to really lower the rate of infection. We have to be well below our gating, and that's a little unfair. That gating criteria has got to be held below. If we do better than our gating criteria, I know that we can actually add more risk. I mean, that's how that science works. But if we can hold the gating criteria, we know we have room. So I know that everybody wants me to say on the day after Labor Day, we're going to go to school in a hybrid model, and everything except for large concerts is going to be open in the state. I wish I had that crystal ball. I think every state wishes they had that. It depends on the penetration of the virus, depends on how long we can, hold the gating criteria. And I want to make sure that kids are safe first, along with their educators, but I am really motivated to keep doing better in terms of our economic successes. And I do want people to hear that. I think there are some New Mexicans who have assumed that we don't want these businesses to make it, and that nothing could be further from the truth. Every loss is a painful loss, so we can't predict for you, but it looks good, doesn't it? Jens, it's feeling right out there. Keep it up, New Mexico.
Thank you, Governor. Next, I'll go to Algernon DeMassa with the Las Cruces Sun News. Algernon, you're unmuted. Go right ahead.
Thank you once again for the opportunity. Thank you. Question for the governor and for Director Coleman distinctly, just about census personnel within the state. Does the state currently, for the last 48 days, have enough personnel as well as enough support against efforts to intimidate either census workers or respondents to the census? And as far as there has been efforts at intimidation, from the politics about the citizenship questions and other efforts, is this sort of a lost cause, or are there personnel that are equipped to address some of the fears that are lingering about responding to the census?
Tough question, and I'm going to give it directly to Director Coleman. I don't know the answer to that. The kind of politicizing from both public health to census and the intimidation and the negative effort by any number of entities and organizations and even the federal government, frankly, today is mind-numbing, and it's so inappropriate and unfair. We shouldn't be politicizing any of these efforts that really they're intended to make a difference in the quality of people's lives. And fear and intimidation are just intolerable and will not be tolerated in the state of New Mexico. Is what we're doing going to be enough to diminish those fears? I can't answer that. I can say that we are doing everything that we know to do to quiet those fears, to provide confidence. I think it says a lot about the leadership when we are very clear that immigration status is protected and not a component about the census, and that this is a state that is really clear about protecting everyone in the way that we are required to by local, state, and federal law, and that we're not going to be bullied or intimidated by Homeland Security or anyone in the federal government that would use those tools in a way they are absolutely not supposed to, including there's lots of allegations now about voter suppression and what's going on in the U.S. Post Office. We'll do everything we can. I don't know how to answer that. I hope New Mexicans feel like this is a trusted, we do everything we can to make you feel that way, credible, fact-based administration, and that we work hard to correct mistakes when we make them. We work hard to minimize that we would make mistakes in the first place, and we follow the facts, and we try to be as transparent. And what I mean by that is if we didn't know about it, we might not have provided that to you. Sometimes you all know things before that we do. We believe in government transparency as well. So I'm going to have Director Coleman talk about what we're doing, but can't answer that question. I hope New Mexicans feel like, you know what, we have your back here every day, every single day we do. Director Coleman.
Thank you, Governor, and thanks for the question. So as to the first part of the question, does the U.S. Census Bureau have enough census workers in New Mexico to provide the services necessary to knock on the doors of all the folks who have not yet self-responded? And the U.S. Census Bureau has not shared the full extent of their recruitment efforts, except to say that there are some locations where they need to recruit more, or how many folks are in the field. I think one of the big reasons we've pushed so hard to encourage self-response is because that very large operation that the U.S. Census Bureau endeavors to provide in census, every census, is such that during COVID, there are what we have learned anecdotally and what across the country we've heard is that fewer people who signed up to become U.S. Census workers turned up because because of any particular risk. So they didn't want to be exposing themselves or exposing their own families. There have been people who have shown up to a census training, and as we said earlier, we encouraged and required the census to have smaller trainings, who did show up, who did pick up their equipment and then decide that it wasn't for them, or that they decided the risk, or that their family encouraged them that the risk was too high. So again, that all of our efforts from a state perspective is to encourage the self-response. And to your other part of your question, which the governor really eloquently addressed, is that because of the federal administration coming out with an executive order and a memo about who was going to be counted and who would be appropriately counted, and that your undocumented status was going to matter Immediately, our partners from the state side, which are community-based organizations all over the state, went into high action and had already been talking to the harder to count communities, the mixed status families, the folks who are undocumented, whether that was with trusted messengers on local radio, primarily Spanish speaking, whether that was phone banking, including phone banking into all these hard to count communities, having folks who are trusted messengers in those communities be able to say, no, it's not right. They must count you. And so that's why it's so important to say that the Constitution of the United States of America says clearly that every single person will be counted. It does not discuss the immigration status. And that's what all of our community-based organizations have talked to these communities about. You will be protected if you are counted, and to do your part by being counted. And thank you for putting the slide up again. Everyone counts. It's age, immigration status, race, income, or anything else. And the fear and the tactics to suppress people being counted when everybody is entitled under the Constitution to be counted, it's beyond wrong. It's unconstitutional. So we have encouraged, and our community-based organizations continue to encourage folks who continue to fill out their census. If you're mixed status, count everybody. There's nothing required for you to say who's living there, as in who the person is, or what their social security number, or whether they have it. So we have done what we can do to counter messaging that is distracting, that is unconstitutional, that is hurtful, that undermines the fabric of what the Constitution says the census is there to accomplish. So thank you for your question.
Thank you, Governor and Director Coleman. Next, we'll go to Brandon Evans with KOAT. Brandon, you are unmuted. Go right ahead.
Good afternoon, everyone. My question is about vaccines, and it's kind of a multi-layer thing. First of all, what is the latest you're hearing about how soon one could come widely available? And also, the percentage, this might be for Dr. Scrace, the percentage of effectiveness, 50%, 90% of what it would take to get it to us, and how are you guys determining who gets it once it is here? Thank you.
All right, so Dr. Scrace, I'm going to start with the last part of that question, which is who gets it. You know, we do have a fairly effective, I think, because it's based on the science, evidence-based, where you would start with a vaccine. So we're going to assume that it's widely available and that it's efficacious, which are the first part of your question, so that it provides immunity for a year. Let's just say that. I hope that that's going to be the case in the vaccines that are in now their human trial aspects of their studies. You go to healthcare workers. You go to nursing home residents or high-risk populations. You go to first responders and workers. When you do that, you work to nearly eliminate, right, all the high-risk, high-mortality groups. The educators would also be in that group. We're going to have to see how much vaccine is available, and I do expect this. I expect there to be a fairly engaged, I hope it is based on science and fact, debate about mandatory populations more than the first responders. And the mandatory populations that I think is going to be a significant debate in the country is going to be school-age children. I can tell you that once a vaccine is approved that meets all, and that's what this country is going to do through the FDA, safeguards, and I do think Operation Warp Speed, I have confidence, because Dr. Fauci says I should be cautiously optimistic that in the winter, you know, we'll have a vaccine available. How much of it and where it's going to be available, that remains to be seen. But after the groups in that public health list have access to a vaccine and are vaccinated, if it's widely available, I'm getting a vaccine, right? I would want my family to get a vaccine. I want them to be as safe as they can now that we have this deadly virus living among us. But that's going to be a real debate, and we're going to use you thought the medical advisory team, Dr. Grace, was going to be done sort of after we get through all the gating. I see a role for us to really work on the priority populations and the mandatory populations. And I think I can do this with a high degree of confidence. New Mexico should expect both, that we'll have a mandatory population. I gave you the basics. Healthcare workers, educators, nursing home residents, nursing home workers, you know, the folks who are really in that high-risk category and that the transmission issues are so significant. Corrections populations largely to probably also be in that group. I might be forgetting one or two of the public health groups. And then a priority list. And that priority list of populations, you know, could be, right, school-age kids, childcare workers are probably in the required list, but we're going to have to, I want more science and folks engaged in making those decisions and making sure that we are promoting productive public health responses once a vaccine is available. Dr. Grace.
Thanks, Governor. Thanks for that question. This is a really important issue, and I think most of us would almost be willing at this point with our COVID fatigue to take any vaccine that was available. But that's not how we're going to do it. We want a safe vaccine. A couple quick points. One is the supply. If we have a huge supply of the vaccine early on, then we're not going to have to make any kind of rationing decisions or prioritization. I'm a healthcare worker. I can't go to work unless I get a flu vaccine, or those are required. And so there's two issues. One is vulnerability, and the other is ability to spread. And so people who have a lot of interaction with the public have more ability to spread, and the governor gave you that list, and it's a great list. And then vulnerability as well. We saw what happened early on in New Mexico with nursing home outbreaks. Unfortunately, those have been largely contained, and we're one of the best states rather than one of the worst. The medical advisory team has sort of figured out a system and a way of thinking that's pretty complicated ethically about who would get a ventilator and who wouldn't get a ventilator if we ever ran out of ventilators. So I'm pretty confident that we have the ethical and scientific and medical firepower in that group to sit down and advise the governor and her team about what we recommend. But I think it's a great outline that you already heard, and I don't really have much more to add than that.
And maybe, go.
One question. I'm kind of in my head thinking that vaccine will be on the market, around the first of the year, and that it will be more widely available somewhere in the first quarter where we have enough to start really significantly distributing it to people. That may sound pessimistic, but these vaccine distribution systems are complicated. It isn't just showing up and sending it out. There's lots of details we have to work out in the process. I know the public health department is gearing up. I know our provider partners are gearing up to, so your doctor, can give you the vaccine. But we've seen with, for example, the shingles vaccine, when it first came out, not that there was any kind of demand for that vaccine like I'm sure we'll see for COVID, but they have had supply chain issues and production issues as well. So in the best of all possible worlds, we'd start with a vaccine that was available for almost everybody and just get those high-risk people done first and then everyone else. But we will have to wait and see. And the last thing is we'll have more evidence, more scientific evidence. With flu vaccine, we've all been getting that for a really long time. It wasn't introduced for kids to get the vaccine until 2002 when we learned that they actually were, in communities, one of the primary spreaders of influenza. And so we'll know a lot more about those dynamics and the school situation as well after 2 or 3 more months, and that will certainly shed light on the order and the priorities as well. Thank you.
Right, and one thing that you didn't ask is we're seeing some productive effort, and again, it makes us all cautiously optimistic that, like Tamiflu, that there might be other distribution components for dealing with COVID, and may not all be a vaccine, or I guess we could call it a nasal vaccine, not all an injection, so a vaccine. And then 2, that treatment remedies are being constantly refined, and they should. All have to be, evidence-based and safe, FDA approved. But like remdesivir, I think there are other strategies, even sort of pre-hospitalization, that would allow to mitigate. So mitigating means that you don't have people who are at as high risk of dying from COVID or needing hospital or needing critical care in hospital. All of those things help us live more normally in responding to this virus. And we're seeing that occurring. And a lot of I think New Mexicans might be surprised that there are plenty of, the labs are involved, LANL's involved, many of our other high-tech companies, and we have, folks working with large national pharmaceutical companies. I'm not going to shout one out because that'll be a bit unfair. There are many. They're all productively, and I believe to date, I've got no reason to believe that we aren't doing that safely. I do have reason to believe that maybe Russia isn't doing it safely. The standards are just different. It's not intended to complicate that foreign policy response, just that our standards are intended to put safety first. And then you look at the efficacy and availability and the manufacture. We do safety first, and I have a great deal of confidence about that effort. So let's see. We're hoping that the winter proves to be a whole different set of productive ways to protect New Mexico and New Mexicans. And so I'm hopeful and optimistic too. I think New Mexicans should feel good that the country's headed finally in that respect in the right direction. And maybe one last thing, and I promise I'll end. We are not waiting for the vaccine. So you heard Dr. Grace, the Department of Health is already, and the medical advisory team, making determinations about what populations first, how we defend those decisions, putting those decisions in front of me so we can communicate them to the public, making sure we have distribution partners, that we're working effectively with the private sector, that we know what we're doing in public health. We aren't going to wait until January to do that work. That work, because it's public health preparedness, we're doing that now and have every expectation that we'll be ready for an effective delivery when an effective, safe vaccine is available. Great.
Thank you, Governor. Next, we'll go to Matthew Reichbach with the New Mexico Political Report. Matt, you are unmuted. Go right ahead.
Hi, thanks for the opportunity. So the New York Times reported today, citing CDC data, that the number of excess deaths throughout the country far exceeds the reported number of deaths related to COVID-19. They said that there have been about 1,100 excess deaths in New Mexico between March 15th and August 1st. Is this something that the state is tracking?
Matthew, I appreciate the question. I'm actually going to defer to Dr. Grace. I will tell you my opinion. I think that, not purposely, but the way in which the guidance for reporting and not knowing enough about the virus, not knowing enough about we didn't have a test that was reliable until late March, frankly, because the initial CDC tests didn't work. They were flawed. I think it would be impossible, like the New York Times, not to believe that we've underreported cases, hospitalizations, and deaths, particularly in areas where you've got individuals that are high risk and had compounding issues and or terminal illnesses. What part did COVID potentially play in that? We want to be a state that adheres to best practices for reporting, can make adjustments in the way that we should. I don't want to be politicizing between the CDC and HHS and the federal government, bureaucratic, unnecessary reporting that's intended, I think, worse to underreport what's going on. But I expect that my modeling team is paying attention to that and providing guidance. So I just wanted New Mexicans to know how I feel about that, and I think that it's likely. I agree with the report, maybe not all the numbers, but I agree with the reporting aspect from the New York Times. I do think that that's been an issue that's been difficult for folks to get their arms around for a number of reasons, and I want to give credit to that media outlet for highlighting the issue again and focusing that we're not doing the right job in this country. Dr. Grace.
Thank you, Governor. Great question. Interesting articles. There's a couple in the New York Times. Actually, they had an article, I believe it was the New York Times, months ago, looking at New York City and deaths in New York City, because at the time, if you remember, there was a contention that people really aren't dying of COVID. Really, they really died of something else, but they happened to have COVID. Well, and what they found in New York City was that of all the deaths that occurred, 75% of them, it was 75% more than the year before, or another way of saying the math is 3 times as many were from COVID as what was expected. So a couple of things about excess deaths. The number of deaths varies by month of the year and sort of peaks in the winter and then gradually tails off, is lower in the summer and goes back up again in the winter. And so we're in a period where normally we would have a low number of deaths. We have a pandemic going on. We know we've had 700 deaths, or just about that, here in New Mexico that are attributed to COVID. I agree with the governor that there are probably some that may have been due to COVID that we don't know about. In fact, months after the initial cases were reported in the United States, researchers went back and found COVID in people who had been declared who had died from some other cause. We do have a really active and strong Bureau of Vital Statistics, and so we can, I think the way I would do that is just ask them, and we'll try to get that data for, death rates for the last 3 or 4 years by month, and then plot this year. And I would just say as a starting point that the difference between what we're seeing this year and maybe the average of the last 3 years would be attributable to COVID. And then you could look at that difference and look at how many cases were actually on the death certificate attributed to COVID, and that missing piece would be potentially excess deaths. A great question. The only way to really answer and to really track coronavirus excess deaths would be some fairly extensive post-mortem cultures on people who weren't attributed to have COVID, and were obviously our priority right now is on the living and testing those who are alive and preventing spread, which generally is not an issue except for in pathology labs after death. So great question, and follow up with us, or we'll get back to you sometime in the next week to 10 days with what we find out. Thank you.
The best part about that question is you got Dr. Grace to agree to research something else. I've had limited ability to do that because it's a lot of work, and I just want New Mexicans to have real confidence that we're willing to look at anything that's evidence-based, that we know that the more data that we are analyzing with the right folks analyzing, the better we are at making decisions that are productive, make sense, and deal with the real serious issues at hand. So we do I appreciate it, like Dr. Scraggs said, we have an opportunity to look, and I often ask questions in the same way, and it causes the MAT to educate me or to provide different data points so that we're all clear. And I think if the country was operating in response to COVID in that way, I think that frankly we'd be in a much different situation. So thank you for that.
Thank you, Governor. Next we'll go to Jeffrey Plant with the Silver City Daily Press. Jeff, you are unmuted. Go right ahead.
Thanks. Good afternoon, Governor, Secretary Grace. I have a census question that I'd like to preface with something. I think one thing the 2020 census got right is self-response. It's unquestionable that online self-response and self-response telephone interviews probably offset some of the negative effects of the pandemic, but for better or worse, the next 7 weeks is largely about counting those New Mexicans that didn't self-respond. And I wonder, Director Coleman, are you aware that the door-to-door enumerators are now being instructed to conduct some census interviews by phone or even by proxy when they can't find someone at home at an address? At the same time, the Census Bureau has instituted a cash bonus incentive program for its enumerators that rewards them for conducting more interviews in a shorter period of time. Director Coleman, would you encourage apartment managers, landlords, neighbors, even realtors, for example, to answer the 10 census questions on behalf of other people? And for Governor Lujan Grisham and Director Coleman, is this a realistic way to accurately and completely finish the census by the end of September?
So thank you for that question. So the Census Bureau has told us that during this operation, which is called non-response follow-up, if you haven't self-responded, that they have told us that they will go to the households who have not self-responded up to 6 times. And that up to 6 times is what they've said. And that by the last time, if they get to the end of, by September 30th, which is the new deadline that Census, U.S. Census came down with last week, that by proxy, asking someone who's a neighbor who lives in this house and how many people live there, that's the count of last resort. That's what has happened in prior census as well, for 2010, 2000, etc. So it is a way that the census, at the very end, if they've made every heroic effort to knock on your door and you weren't there and you didn't respond to a postcard that they left that said, hey, we got here and you weren't here, please, you can complete it online by phone or call us back. So that, or to return the envelope that you would have gotten at your house. So that is a U.S. Census process to do by proxy. And again, it's not the first, they don't go to the, this is what their protocol is, as they've communicated it to us and has happened in census of past, is that they don't do that the first time around. They don't say, knock, knock, you're not home. Hey, building manager, I just went to this person's house or this person's apartment, who lives there. That is not the way that the census has communicated it to us, nor has it been the way that they've done it in census past. So up to 6 times is what the U.S. Census has said that they do. And then to your other question about calls, so one of the, whether that the U.S. Census will call you and say, hey, you haven't completed your census. They don't know what your phone number is if you haven't self-responded yet. What they do right now have is something that's called the virtual questionnaire assistance, or the mobile questionnaire assistance. So if you have not completed your census and you hear on the radio, for example, hey, if you haven't completed your census, sponsored by the census, call this number or text this number and someone will call you back in 24 hours and take your information over the phone. So I'm not sure if that's happening down in Silver City on radio, but it is happening on rural radio all over the state and has been a big push and something that the iCount&M statewide partners we're doing with rural radio and with the counties, and some of those counties have already done that. So again, it would be an event where the radio station for a period of time, maybe for an hour or half an hour block, says we're going to do census programming. They talk about the census and then say, if you text this number, someone from the census who is a U.S. Census person will call you back. And that is 100% legit and something that we are advocating, because there will be people who can be called back who otherwise didn't find their envelope, lost their envelope, didn't want to open the door, didn't feel comfortable opening the door, and that is a legitimate service that the U.S. Census is offering, and we are happy that they're doing it. It's a very innovative way to approach during COVID, and one that we hope to show results, as you point out. We are looking for self-response in any way possible. And then the last question you had was that you've heard reports that the U.S. Census is offering a bonus to enumerators. That's what the census takers, when they knock on your door, that's their title. They are enumerators, that they can have bonuses if they do more, if they stay on the job more. And most of these jobs are, these census takers are part-time, and they don't have enough. That's why they're doing a bonus in that way. So offering a bonus from the U.S. Census to those U.S. Census workers for them to go to the extra house or spend a couple extra hours to find it. I think it's a good way for Census to make up for the fact in some ways that they are abbreviating the census by a whole 30 days. Do I think it's enough? No. Do I think that that they are doing enough? We're doing everything we possibly can under the direction and leadership of the governor to make sure that wherever we find a hole that we can plug, and every time we can send a message that says complete your census, it's super easy. Go online, 2020census.gov, or call the number in English or Spanish on your screen, or if you're hearing impaired, call the other number. We are doing everything we can to fill those gaps, but it is a U.S. Census Bureau operation. Someone who works for the state by itself, we are not enumerators. We are not sworn enumerators. Only U.S. Census personnel can take your census, and that's why those virtual census activities are so important right now. and why we so strongly encourage everyone listening. If you're watching online, you can go online, obviously because you're online right now at 2020census.gov, and go on. You can call in English and Spanish, and if you're hearing impaired. And it's so important, I think, for everybody on that question that you're asking about whether bonuses are appropriate, whether someone should talk to their neighbor about who lives in that house, or whether someone should take a phone call from the census to say, yeah, I did just text you, and I will tell you, because I just texted you and you're supposed to call me back, that is the most important thing, is to spread the word that census is happening now, and the deadline has been ratcheted up to September 30th, and we need people to be counted. So thank you so much for that question and the opportunity to talk about the virtual questionnaire assistance.
Yeah, I mean, this is a situation, again, where the federal government didn't handle census right in a number of ways by first putting a citizenship question, which is unlawful, and creating any number of both legal challenges and debates around the country, again, causing confusion, delayed starts, and credibility issues. I want to make sure, again, that we don't incentivize someone to harass an individual at someone's house or to potentially fraudulently fill out a census document. I actually think that the likelihood of that is low. I don't have the facts to back that gut reaction to that. I agree with Director Coleman that going door to door and being COVID safe is a challenge. And getting people to open their doors, because I've asked for other active door-to-door salesmen, political organizations, candidates, to really try hard to find other vehicles to do that effort, right, to connect with households, because it's a risk in COVID. And we think the same thing with census workers, and we really push them, I'm going to say arguably harder than any other state, that they had to meet our COVID safe practices and be creative about how they did that, and even training and certifying their personnel, because we want to make the right differences and protect New Mexicans. I would guess that getting them to do more in a day and to really get to those households and to be as assertive and professional about that is a fair thing to try to incentivize, because quite frankly, they should not be reducing the time frame and putting states like ours, any state, into a situation where you're going to be undercounted. So anything that gets us not to be undercounted or so egregiously undercounted, I think our opinion is, unless we see something significantly problematic, is to embrace that as the flexibility to meet our goals in census reporting.
Thank you, Governor. And this will be our last question from Julia Goldberg with the Santa Fe Reporter. Julia, you are unmuted. Go right ahead.
Thank you, Nora. Thank you, Governor, Dr. Scrace. I wanted just to clarify regarding school reopenings when they happen. The Los Alamos National Lab modeling at the end of July shows the impact of different scenarios for school reopening in chart form, and all of them, even the ones that have the highest, transmission reduction factor, show increases at the state level. And so I guess my question just simply is, should people expect that if/when schools reopen, there will be an increase across the board with the gating criteria, but the goal is to keep it below a certain level? I wonder if there's any way to be a little bit more specific about what we should expect to see in terms of when schools open. Thank you. Appreciate it.
Yes, you are right that we expect every time we introduce risk, and schools in particular, right, inside, duration, populations that are in close contact even with social distancing requirements and COVID safe practices, and the fact that so far we are seeing large-scale problems with back-to-school in-person education, not just around the country, but around the world. Challenging. That's not to say it's been, there are some successful efforts around the world, but they have very, very strict COVID-safe practices that I don't think we can adhere to productively, and we don't have the science to back that up in the context of what's appropriate and protects people's privacy, et cetera, that we will uphold in the country and in the state. Your question's a good one. How much do you think it will? It depends. We expect to have an increase in transmission. My goal is that we're so successful that it's small. If we double the cases, right, you're looking for exponential issues, then I would certainly push the modeling team to explain to me what we need to do to nip that in the bud quickly, because remember, every additional case is an additional case and an additional case, right? It's exponential. So I worry about that, and we can see shifts in positivity rates. I don't know what we're going to decide is the acceptable bump, if you will, and I should know that. So let's ask Dr. Grace and get an answer to that.
Thank you, Governor. Thank you, Julia. Great question. Echoing the governor, anytime more people are getting together for longer or in more places, we're going to see an increase in cases. When we did what we thought was the dimmer switch, slight increase in reopening in June, we tripled the number of cases. By the time the number of cases had been doubled, we kind of overwhelmed our ability to contact trace, which sort of is a double injury because it allows the case growth to go even higher. When we had the debate about what number of cases per day, and 8 per 100,000, which is the 168, we talked about the importance of having room in there for the inevitable case growth. But I think what we were thinking of would be acceptable would be the 25, to 50% case growth. So, going from 168 to whatever that would be, 250 cases, where we could still contain it with contact tracing. Less is better. I can tell you for sure, though, that if people take, for example, a school reopening as a cue to get out more, not have to wear their mask, it'll be way worse than that. And I think we have the ability as a society and as a group of New Mexicans to make it better than that as well. And so I think schools absolutely have to be rigid in mask enforcement, apart from some relatively unusual medical condition. My view is we shouldn't have students or teachers in a school building unless they're willing to wear a mask. Now, I'm sure it's more complicated than that, but it's going to take a 100% approach to prevent spread in closer quarters with more people, and it's really going to be important for us to all do that. And even parents of kids getting out more as their kids get back to school is also a factor as well. We want people to be able to do that, but we want them to do it safely in order to give us room. And so we're still really hoping for the dimmer going up, a little bit, not just flipping that switch. Because I think if we end up with a tripling of our case counts every time we open something up, we're just looking at a roller coaster of daily cases between here and when we get, 2/3 of our population vaccinated. And that's an awful lot of effort, an awful lot of heartache for business owners and for teachers and parents and others. So I think the governor's right. We have to keep pulling on this one. Just opening a little is a cause for more concern, not less. Thank you.
All right, so Dr. Grace, I don't think I've ever had you give us a range that's not so definitive, but that is an important question. It's something actually we debate, and they're because each state is in a different place, and then the risk to the populations. Here's another risk factor for New Mexico. We have older, I hope that doesn't sound, we've got more experienced educators in New Mexico, right? This is a vocation, they stay in it longer. That's an incredible thing about the dedication of our public school employees. The negative is it puts you, just by virtue of your age, right in the high-risk group. So we have to do better, arguably, and we have a teacher shortage even without COVID. And when I say teacher, right, we have a public education employee shortage. It's teacher aides, it's educators in the classroom, it's everyone who has to go to work in a school to make the school work during the day. So it's everyone. Bus drivers, everyone. We can't, just like the healthcare beds, New Mexico, let's say the national average is you can keep going and manage your contact tracing, your testing, and you don't overwhelm the healthcare system, and you're still doing everything you can to minimize mortality. I mean, that has to be our goal. And every other state in the nation can go to 50% bump over that 5 weeks and then see it come right back down. Well, New Mexico would arguably, I'm going to make it just simple math, which is not the right formula. Since we have less, by at least a third, healthcare capacity and hospital capacity, right, then we can't be at 50%. We'd have to be at 30% or 35%. So we're going to have to really think about what that is, and we debate it all the time. For me, emotionally, and it's not how we make decisions, I don't want a single case increased. Right? It is earnest when I say that your New Mexico team is upset every time we get any numbers about spread, increased cases, people in the hospital, people on ventilators, people who are having a hard time recovering, and people who die. It is horrific data to have to deal with every single day, 7 days a week, knowing that you have nothing really you can do except these public safety issues and public health issues. Thank you, New Mexico. That's really all we have, and restrictions until we get a vaccine. That's painful. But we're going to have to accept some risk because you have to balance that, and we do, using science, good data, with what's acceptable in terms of that risk that minimizes exposure, transmission, and mortality rates in the state, but allows us to build in these normal lives. And we do know that we do have kids who are not served because of our lack of connectivity, or in households without the right support and devices. Single parent working can't support that mid-school or high school student during the day when they're gone, and they're an essential worker. Right? We have some real challenges here. So I really appreciate that question, and I'm going to ask the MAT to do better at giving me earlier, more definitive answers, because I think the more information we provide to New Mexicans, I think the more they understand that they have a lot of power to help us never get to the worst case scenario, which would be a 30+%. And everyone, that's an example, not the decision, about where we go. So I really appreciate that. I just want to end with this. This is good news. We're doing it right. We're showing that we can do it right. But we are not there. I need younger people to do better at mask wearing, not socially gathering, not having backyard parties. Be careful in your dorm rooms. Really, really be cautious. This is a deadly virus. No one is immune or exempt from catching this virus. So you have to do everything in your power to protect yourself. And when you don't do that, and you have a cavalier attitude about it, then you put somebody else at risk. And they're doing everything right. So let's keep showing the country what leaders New Mexicans are. Let's show the country that we can attack this virus and push it back. And let's meet as many of our goals, including in-person education and some continued easements, so that we've got economic success stories to be talking about at our future press conferences. So good for you, New Mexico. Good for us. And thank you very much for tuning in. We appreciate you.